Hi, my name is Marcos Basto, and I'm a student at LG Community College. I also work for Open Door Health Center of Illinois, which provide medical services for people living with HIV and AIDS. We also test for sexually transmitted infections and HIV. Some of the most common sexually transmitted infections that we see in our clinic is chlamydia, gonorrhea, syphilis, herpes, genital warts. Along with that, HIV. At Open Door, we provide services for about over 700 clients who are living with HIV throughout the Kane County, McHenry, DuPage, and Cook County. The way that we test for sexually transmitted infections is through a urine test, which tests for chlamydia and gonorrhea, which are bacteria that are curable. We also test for herpes, syphilis through a blood test. And the only way to know if someone has a sexually transmitted infection is through a test. You cannot tell if you have an STI just by looking, by thinking that you have it. You have to have a test. In order to make sure that you are okay, you have to have a test, either through blood, or if you are checking for chlamydia and gonorrhea, that will be through urine. We don't do the swab on the penis anymore because a lot of people is afraid to do that. That's why they don't get tested, but it's not painful. It's just a urine sample that we take. If someone is infected with chlamydia or gonorrhea, we give them medication and they are okay in about 2 weeks. If someone is infected with herpes, which is a viral infection, that person is infected for life. There's no cure for herpes, but there's treatment, which the treatment can be given while the outbreak is happening. Some people might have to take medication for life because the outbreaks are very hard on people. So, but in most of the cases, people just take the medication when the outbreak happens. For genital warts, there's no blood test. The only way to diagnose genital warts or human papillomavirus, which causes genital warts, is through a physical examination by the doctor. And the genital warts could be either in the penis, vagina, or rectum of the person. It can be also in the mouth. So oral sex is not safe sex. You can get any STI through oral sex. You can get chlamydia, gonorrhea, herpes, syphilis. And we also test for syphilis, which is a bacteria that is treatable. Once a person is infected with syphilis, that person is going to be reactive in a blood test for syphilis. It doesn't mean that the person is infectious if it got treated. If that person got treated, the test that is going to be done eventually is going to be reactive. So that person is going to be reactive all the time. So for syphilis, it's important to get tested because it's very common, and people don't even know that they have it. So the first stage of syphilis is an open wound, an open lesion, either in the mouth, penis, vagina, or rectum. People don't feel any pain or itching or anything. They just feel a little bump, and people don't even feel it sometimes, and it goes away without treatment. The second stage of syphilis happens about 2 months after infection, and it's a rash on the palms of the hands, soles of the feet, and torso. That rash goes away as well. And then the third stage is a chronic stage in which the bacteria goes into your organs. It goes into your liver, kidneys, heart, vision, and brain, and it can kill you. But we can stop the process of this infection if we cut it on time. So that's why it's very important for people who are sexually active to get tested for all the STIs. We also do HIV testing, which stands for Human Immunodeficiency Virus. And this virus is transmitted through blood, semen, vaginal secretions, and breast milk. You cannot get infected through touching, kissing, hugging, sharing dishes or food, washrooms, anything like that. You cannot get infected. But you can get infected through unprotected sex with someone who could be infected by exchanging bodily fluids when a sexual contact is done. Or sharing needles with someone who's positive for HIV because of the blood, not because of the needle, but the blood that transfers the virus into another person. The way that we test for HIV is through a rapid HIV test, and results are given in 10 to 20 minutes. If the test is positive, then we link that person into our medical services at Open Door. We provide comprehensive medical services for people living with HIV, case management, primary medical care, behavioral health, support groups, and all the services that a person might need in order for that person to be healthy. Nowadays, HIV is a chronic illness that can be managed very well. People don't die of AIDS anymore. That person can stop the process of the immune system being destroyed by the virus, and that person doesn't have to have AIDS, which is the last stage of HIV. So nowadays, the medication works very well, and it's only one pill in most of the cases that the person takes. Prior, back in the 80s, people used to take 20, 30 pills every day. Nowadays, it's not the case anymore. It's only one pill, and the side effects are very mild. But still, you don't want to get HIV because it's a medication that you're going to have to take for life. And it's very expensive as well. So it's important for people who are sexually active or who could have been exposed to the virus for any reason to get tested. The test is free, and we provide these tests seven days a week. People just need to call me and make an appointment, and we can get you tested and get your results. And there's all the information is confidential, and that information is kept private. So we don't share that information with anyone. The test is provided at Elgin Community College twice a month, and by appointment in any of our locations, Elgin or Aurora.